The Canadian Skin Patient Alliance is Canada's go-to resource for information regarding conditions that affect skin, hair, and nails. A national nonprofit organization, their mission is to promote skin health and improve quality of life. Rachael Manion is the executive director of the Canadian Association of Psoriasis Patients and the Canadian Skin Patient Alliance. Drawing on her background as a lawyer and consultant, Rachael brings a strategic and creative approach to advocating for better patient care. She joins me now to share details on their new Is My Prescription Covered tool available to Canadians now. Welcome to What She Said, Rachael.
Thanks very much, Candace.
So tell me, what is the Is My Prescription Covered tool?
So this is a free tool that's available on our website, canadianskin.ca. And the purpose of the tool is to help people figure out, by answering a series of yes or no questions, whether the medication that's been prescribed to them is covered for them. Because this is a very complicated question for many folks, and we are trying to make it easier.
All right. So why the need for the tool then? You mentioned it's complicated, but obviously you're filling a gap here.
We are. So our organization is 15 years old. The Canadian Skin Patient Alliance is 15 years old. And we have heard over the years from countless individuals who have come to us saying, I've been prescribed this specific medication and I can't afford it. So how am I supposed to get this covered? And so we work with them on a one-to-one basis in order to help them figure out whether there is either a plan that's available to them that they weren't aware of, or how to maybe locate some private plan that might fit for them, so that they can afford these treatments. It's really, accessing medications is really vital for people's health, and that includes their mental health, quite frankly, Candace. And so, but the way that medication access is structured in Canada is not very straightforward. There are all kinds of inequities in the system, and it can depend on where you live in the country. It can depend on how old you are, whether you're part of sort of a special population. So here in Ontario, kids that are under 25, or kids and youth, I should say, that are under 25 and don't have access to private coverage are covered by the provincial healthcare or by the provincial drug plan. So that's one of those sort of examples of do you fall into a special category where maybe these drugs are actually going to be covered for you?
Yeah, and I imagine, everything through the pandemic became so complicated. I can't imagine that it made this process any easier. You've mentioned a lot of this, but this tool is going to improve healthcare for Canadians coast to coast, right?
That's our hope. That's our hope with it, Candace. Yes.
Okay, so how do people access it and use it then?
So right now, it's just a module on our website. So if people want to go to canadianskin.ca, they'll see up in the top right corner a little link to something called Is My Prescription Covered, which is the name of our tool. And all they have to do is click on that. They get some information about how the tool works so that they kind of have a sense of what to expect as they work through it. But really all it does is ask yes or no questions. And so, they don't have to give us their name. They don't have to tell us where they live. They don't have to tell us what kind of condition they're living with or what medication it is. We really set this up to be a portal to this kind of information. And these plans kind of fit together or don't fit together in a real sort of a patchwork way. So what we did is we worked to lay out all of that on the back end. And we just formulated it through, as I mentioned, yes or no questions. So, do you live here? Are you this age? These kinds of yes or no questions. And people can just continue to click on through until they find something that resonates for them. And then what our tool does is it points people right to the source, right to that drug plan, for example, that they might be eligible for. And then they can look up on that website. So the website for the drug plan, they can look up what is the medication, and they can look up whether it would be covered for them. So we know that the actual drug plans keep these websites very, very well updated. And so there's no lag of information on our part, but it's sort of like you can think of it like a concierge service. You can think of it as a portal. You can think of it as a tool. There are all kinds of different ways to describe it, but really our goal, Candace, is to help people get to this information so that they can get the medications that they need and they can get on with their lives.
So I'm sitting here listening to this, and I would like you to take over a lot of things. Can you help people find family doctors?
Oh my goodness,
waiting times in emergency rooms. I mean, this is really brilliant. I'm hoping you'll just expand on this.
You're absolutely right. I mean, the healthcare system is very complex. And in Canada, we think of it as a healthcare system, but really it's a whole bunch of systems. And there's an interplay, I should say, between public and private, and accessing primary care providers is a really big issue in this country, Candace, absolutely. And especially for people who live with skin, hair, and nail disorders, they often really have to be referred to a dermatologist or some kind of specialty care. And if you don't have access to a GP, you're not going to be able to get that referral. So we know that there are a lot of issues with the healthcare system and accessing care. And this was sort of one of our big keystone pieces to helping people access medications, but accessing care, you're absolutely right, is huge, and it's really on our radar. It's something we're going to be looking at next.
All right. Well, I'm totally in on that. So this is obviously skin, hair, and nails. That's your purview. But is that all the tool covers, or are there other things people can access there?
That's a great question. It's actually built for everybody. It took just as many resources and it took just as much analysis to build this tool for everybody. So whether you have a neuromuscular condition, you live with arthritis, you live with any kind of condition or disease, this tool can help you. We know that there are actually over 3,000 skin, hair, and nail conditions. We know that there are skin cancers. There's over 1,000 rare skin diseases. There are inflammatory skin conditions. So our world touches a lot of the healthcare system and of these different kinds of drug programs. So we just built it for everybody. We thought that was going to be the fastest and easiest. And I think we might have been right, even though that seems counterintuitive.
I really love that, actually, that you brought in everybody and thought of everybody and not just, who you may be assisting. That's brilliant. So what is have people been responding? Has there been a lot of use of it yet?
Yes, there has been. And because we don't ask folks for any of their personal details, we really are only able to monitor sort of how people are moving through the tool generally. So we can't monitor how a single individual moves through the tool, but we are noticing that there's a lot of interest. And because we built it in English and in French, it's actually available. The entire system is available in both languages. We're learning a lot about sort of where people are getting stuck and where they're sort of exiting the tool in order to go to that specific drug plan and do their own research about their specific prescription. So it's fascinating.
And how long has it been since it's launched?
It's been just over a month, probably about 6 weeks that we've launched it, but it's up there. It's not going anywhere. And we will be reviewing the policies and stuff that inform how this is set up. We'll be reviewing them quarterly, but we can make changes anytime if anything big comes around. So we're striving to keep it as updated as possible with our small team.
Well, I am excited to see where you take this. Actually, it is quite brilliant. So I want people to be able to find it, obviously, to access it, share it with friends and family. So where can they go? And I do have one other question before we get to that. Is this an app at all?
No, it's just on our website. So you don't have to download anything. You don't need a smartphone, any of that. You can use it in a public library. Like, it's very accessible.
All right. Excellent. Okay. So then where can people find it then and share it or use it themselves?
So if they would like to go to our website, in English, it's canadianskin.ca, and they'll find up in the top right-hand corner, is my prescription covered? They'll find it from any page on our website. And our website in French is apropos.ca. And you'll also find mon ordonnance est-elle couverte in the top right corner. And the system is identical in both languages. So we're really trying to make this as available as possible.
Incredible. This is amazing. Thank you so much for joining me today, Rachael.
Thank you very much for having me.